How are we feeling? Yeah. I don't blame you for being a bit nervous. That's pretty typical. But after today, you're going to be on the path to healing and you're not going to have such a sore throat anymore. That's good, right? I know, I get it. It is definitely hard to see that side of it at this point, right? Yeah. So, really quickly before anesthesiologist comes in here, I'm going to be sticking some electrodes on you, little stickers, so that way we're able to track your heart rate and your brain waves while you're under anesthesia, okay? Okay. No, I don't think I need to shave anything. I think, yeah, we're okay there. So, just have this, see, this little sheet of electrodes here, and they have a little snap, so that's what we're going to be sticking on you. That down for a sec. And I'm just going to be feeling for a spot in between your ribs. Okay. Not a big deal, right? And tap my finger. Unstuck to immediately get stuck to me. Okay. Okay, so then I got one I'm gonna place right here. Okay. Come on. All right. So now I'm going to be sort of moving around you, cleaning your body a bit, okay? It's going to be a little bit on the scratchy side, but we need to make sure that everything is nice and clean, alright? Okay. So let me just get my stuff here. Okay. So I'm gonna feel that scratchiness here. To get all of our lights on here. That way we have absolutely no shadows. Okay, how am I looking here? You ready for it? Yeah, come on in. Just get everything cleaned off. Alright. How are we feeling? Feeling ready? No, this. Yeah. That's okay. In just a moment, I'm going to be giving you a medication that's going to help you feel very relaxed. Alright. Okay. Let me just pop some gloves on, alright? In just a moment here, I'm going to be starting an IV for you, alright? And it's going to really make you feel very relaxed and a lot more comfortable, okay? First, though, I do want to take a quick peek just inside your throat, just to make sure that we don't have too much inflammation going on that would be an issue. All right. Okay. So, hey, Chels, where are we at? Just getting everything cleaned up here. Hey. So, how are we feeling? I'm sure everybody's asking you that, right? Par for the course. We're gonna really help you feel a lot better today, okay? This is a very, very routine procedure. I can do it in my sleep, but don't worry. I'm wide awake, okay? Okay. I'm gonna let them take care of you, okay? So you probably won't see me again until after you wake up, but I will be with you the entire time, alright? And our anesthesiologist is also going to be watching over you the whole time to make sure you stay asleep and everything stays nice and stable, okay? Okay. I'll see you on the other side, alright? Right leg. There we go. Okie doke. quickly. I can just get you to open for me. Beautiful. Alright. And everything looks good. Okay. I'm gonna go ahead, I'm gonna step around you and you're gonna feel me kind of pushing on your elbow, looking for a good spot for a vein, okay? We're looking for a good vein for an IV. So, step moved over. Let's see what we got on this side. Check this arm too. Nope, I think I like this side better. I'm gonna be wrapping my tourniquet around your arm. It's gonna be a bit tight. Okay. It's not gonna stay on you for very long. Grab my one stand by here. Gonna feel a quick poke, just like that. Good. Get the tourniquet off, yeah. Right. Get you hooked up here. nice and protected. One more piece of tape here. Alright. Good. That should have you started to feel a bit more relaxed, yeah? You might notice that your vision's getting a bit blurry. And that's okay. That's to be expected. It's what's supposed to happen. You might feel a bit of a warm, flushing sensation. And that's okay too. Just getting things hooked up here. So, I have a mask here that I'm going to be placing over your face, okay? And then we're going to count down together from 10, alright? So, I'm going to be placing this over you. Actually, let me just adjust it here. Okay, just like so. So, are you ready? 10, 9, 8, 7, 6, 5, 4, 3, 2. Alright, looking good here. So, into our track the jaw open. again. Okay, so let's take a look here. Yep. These are looking very inflamed. They need to come out. Alright. Took our margins. And our blood supply can move. This one is quite a bit inflamed here. Can I get some irrigation here real quick? I don't want the tissue getting too dry. Clamping off the side. Okay, looks good. got one. Get that sent for path. Then irrigate. Great, okay. Going in with an antibiotic. Alrighty. Steady. Alright, I'm gonna remove the clamp here. And centimeters. And it looks good. Let's just trim that down a bit. And now take a look at the other side. This one's going to be a little more difficult to clamp here. But I think we'll be okay. Okay. Okay, going in with our scalpel. Alright, got it. That side was a bit more finicky. Right. Beautiful. Okay, I think I can let the clamp sit now. Antibiotics in here. Okay. Alright. Go ahead and suture that side. Tube. We're good. Alright, let's remove our clamp for a moment of truth. Okay. Looking good, everyone. So, go ahead and remove these. We can go ahead and get our patient moved back to recovery. Oh, hey, you're awake. I thought she might be waking up pretty soon because I just put that down. I just opened up your IV. So don't try to talk too much. Let me give you some water, okay? Take a sip. Nice and slow. If that's a little bit too much for you right now, I can actually get you a swab instead and just saturate it for you, okay? It's really important that we keep your throat nice and hydrated and we don't let it get dry at all. It's going to help with healing and also controlling the discomfort. So just take the straw out for a moment. And I can just stick this to the hole. Okay. Put that to the side. Alright. So go ahead and perfect. Okay. If you need me to rehydrate that swab for you, let me know, okay? Okay. I do need to do a few things just to make sure that your cognitive functions are intact, that there's no neurological issues, okay? So to start, keep your eyes open for me, alright? Good. Excellent. Right. And then just get over. Keeping your head square. I want you to just follow my light with your eyes. Good. And are you seeing any light trails? Okay. It's really important that we check that and make sure that we don't have any issues or deficits. Looks good. So now I'm going to hold my fingers right here, and I want you to let me know when you stop seeing them. Okay. And this direction. And when do you start to see them? When do you see my light enter your field of vision? Okay. Other side. Good. Good. And underneath. Excellent. All right. Great. Okay, one more. Actually, two more neurological tests we gotta do. Right, so close your eyes for me, okay? Beautiful. I want you to tell me when you feel my cotton tipped applicator here touch ya. Yep. Good. Okay. Good. Alright. Good. So then I want you to tell me if this feels sharp. Yep. Or dull. Good. Yep. Good. can open your eyes. Right. So now it's going to look like I'm going to poke you in the eye. And I promise you I'm not going to. I'm just making sure that your blink reflex is intact, okay? So. Good. Excellent. Good. Good. Okay. Okay. All right. Excellent. So, I'm not seeing any neurological deficits, which is great. Oh, yeah. Here, grab that. Put this down. Do you want me to get it wet for you again? Actually, before I give this back real quick, let me just take a look inside of your throat, okay? Perfect. See, looks good. Open. Good. Alright. Is that helping? Okay. So, can you tell me on a scale of 0 to 10, 0 being nothing, you're totally fine, and 10 being excruciating pain, like you're gonna pass out, how would you rate your pain level right now? Okay, good. Yeah, the medications, the anesthesia in particular, should still be in your system, which means you shouldn't be feeling too much. But if you start feeling uncomfortable, let me know. We did preemptively start some pain medication for you, which should help quite a bit. Okay? But if you have any breakthrough pain, I want to know. So then real quick, I'm going to feel very gently around your neck and throat. Sorry about that. Just looking for any extreme swelling that might be problematic. Can I get you to swallow for me? Okay. And again, swallow. Sorry, don't mean to bump that. And again, swallow for me. Okay. Alright, looking good. Okay. to your chest here, okay? So can I get you to take a deep breath in for me and out? Okay. Again. 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 Okay. And just breathe normally. Okay. Everything feels and sounds okay. I'm gonna take this from you, okay? And before I step out, I want you to try and take some sips, okay? So, go nice and slowly. Good. Okay. Like I said, it's really important that we keep you nice and hydrated. Yeah, the IV is hydrating you, but we need to keep your throat nice and moist because, like I said, if it dries out, it can actually trigger more bleeding and also cause more pain. We don't want that. We want everything to heal nicely. So I'm gonna step out in just a minute. I just need to chart the rest of your vitals. I had started, but then you woke up and you're more important than my charting. Oxygen saturation 98, perfusion rate 60, BP 120/80, respiration 20, temp Are you warm enough? Okay. If you decide you need another blanket, if you start feeling cold, feel free to push that call button right there, okay? It's on the remote, and it's gonna call us at the nurse's station, and someone will be right in, probably me. In the meantime, I have your water right there for you, so make sure you keep on hydrating. I will be coming back in here in about 30 minutes, 45 minutes to check on you again, alright? Okay. Right outside the nurse's station if you need anything. Don't hesitate to page me, okay?